Welcome to Climate Change and Health in Small Island Developing States Focus on the Caribbean. If you require translation into Spanish or French, please use the link posted in the chat and choose your desired language at the bottom of the Zoom screen. You should continue to keep this browser open as well to utilize the chat and Q&A features. Please be sure to scroll down and mute the video. Please use the Q&A feature to submit any questions for the speakers. This session is being recorded. Thank you.
Hello. Good morning, afternoon, evening, everybody, and welcome to this session. Yeah, sorry, forgot to turn on my video. Anyways, welcome everybody to this session where we will be talking about the role of national public health institutions in their contribution, but also their unique position of working with research, policy, and practice in supporting the actions globally for both climate mitigation and adaptation. We have a fabulous session. We have a fabulous panel of 3 stellar speakers today representing different national public health institutions. And I look forward to listening to all the inputs that you have and sharing your experiences and hopefully demonstrating the strength that national public health institutions bring to this table when we are in this kind of overall fight that we are trying to succeed with for climate change globally. So I would like to introduce the first speaker for this session, Dr. Anne-Catherine Wisso. She's a toxicologist by training and is currently the Deputy Secretary General of the International Association for National Public Health Institutions. Many of you will know it with its abbreviation IANFI. And she is going to talk to us about engaging and supporting national public health institutions as key climate actors. She is also the Deputy Director, Science and International Office at Santé Publique France, which is the National Public Health Institution of France. She's also has been in charge of several European projects and also European affairs since 2006. So several decades of working in international collaborations, and we look forward to hearing your thoughts. Over to you, Anne-Catherine.
Hello, good morning or good afternoon to everyone. I would like to thank the organizer for giving us the opportunity to present the work done within the association on climate change and health. So if I could have the first slide, please. Okay, so before I go into the details of the presentation, I think it's very important to say a few words about what are the functions that NPHIs can mobilize to participate in climate adaptation and mitigation, given their roles at national level. So there are 3 main functions which are mobilized in for this. So first of all, it's monitoring and evaluation. The second one is responding and facilitate action through evidence-based public health intervention, providing advice to policymakers, supporting adaptation of public health services, work on extreme weather events response and preparedness. And the third category is to promote, protect, and educate in different ways. And of course, we can think about training, prevention and health promotion, workforce development and research. So I thought it was very important to explain what is an NPHI, because IANFI is the association of 110 NPHIs from 95 countries. So to give just this information about how they can be a resource for that work is very important. So if I could have the next slide, please. Okay, so IANFI, what is it? As I've said, it's a network of 110 national public health institutes from 95 countries. Its mission is to bolster global public health capacity by creating, connecting, and strengthening the world's national public health institutes. And as the two other speakers are from two national public health institutes which were leading this group, Public Health England and Santé Publique France, I would like to mention them and thank them for the work they have done with the working group. How do we do that at YANFI level? We connect the NPHIs across the world. We enable them to share best organizational practices, and we do our best to support the mobilization of peer-to-peer support between our members to address different issues, and climate change and health is of course one. May I have the next slide, please? Okay, so I think it is very important also to say that it was decided to create a working group within YANFI addressing the challenge of public health and climate very recently. But why have we decided this? It's because we have found out and we have considered within the association that it was quite difficult for NPHIs to be heard on the importance of public health consideration in the response to climate change. And by being together and having a collective view on what NPHIs could do would be very helpful to make the NPHI stronger at national level, but at the global level as well. So what we have done in that working group since 2021, it's first to do a survey on the role of NPHIs in climate adaptation and mitigation, and to launch what we have called and what we will present in November, the YANFI Roadmap for Action on Health and Climate Change. So as you can see at the bottom of my slide, there were 15 member institutes who contributed to that working group from all over the world. I'm not going to state them all, but they are from Europe, North America, Africa, I think that's China as well. So as you can see, it's a broad range of institutes with different capacities and working in different contexts. From that survey, I would like to summarize the main points, and if I could have the next slide, please. So the main point from the survey, first of all, among our members, 43 NPHIs responded to the survey, which is quite good. A majority of the respondent countries told us that they have a national adaptation plan or strategy, as you can see, 77%. And in most instances, the NPHI contribution was frequent, but was not systematic. Few NPHIs are involved in national mitigation plan or strategy, nearly a third, or a little bit more than a third. NPHIs participate in identifying the most frequent climate-related risk. They collaborate with diverse sectors and stakeholders. And all core functions, I've mentioned some of them at the very beginning, are impacted by climate change, with some most frequent and some with needs, meaning that well, some are more frequently impacted. The survey gave us some ideas for collaboration between NPHIs, and we will present that later. And we have to say that it was quite informative to see that very few of them have completed a carbon footprint assessment, only 4% of the respondents, so less than 10%. So if I could have the next slide, please. Before going into the description of the roadmap to action, I would like to just summarize some important points that we had seen from the survey, particularly with regard to the core functions which were impacted by climate change. I think it's important to understand what's come after that. Core functions impacted by climate change are primarily public health monitoring, surveillance, research, and health promotion. And in terms of collaboration with various sectors or stakeholders, with regard to the range of sectors, it's healthcare, agriculture, forestry, urban planning, and land use. And the collaboration with stakeholders can really be with different organizations, ministries, university, scientific agency, municipalities, etc. And for about ideas for collaboration, as we can see, there is a need and a call for collaboration and interest to work on indicators, advocacy, tool to support adaptation and mitigation strategy at local level, vulnerability and risk assessment, and also how to implement in concrete terms planetary health and One Health approach. What I think is very important is that from that survey, we see clearly that NPHIs are already doing a lot of activities like mapping, monitoring, addressing the physical and mental health impact of climate change, but very few of them consider themselves as key climate actors, and their involvement in countries' national and regional climate adaptation and mitigation policies is rather limited. So this is really an issue for us. And we know that institutes, they do not have enough resources or appropriate resources to develop robust health and climate program, while they could have a strong role to play in supporting an intersectoral approach of climate change and health and international collaboration. So when we come from that knowledge to the roadmap to action for NPHIs and climate change, we see that it is that the priorities for the roadmap are as follows. First is to develop advocacy actions in relation to strengthen the capacities of NPHIs to contribute effectively to climate and diversity research, policy, and action. The second item of the roadmap is to enhance capacity strengthening, competence development, and training through peer-to-peer exchange and knowledge sharing. And I have to say, this is really the core business of YONFI, is to support that peer-to-peer exchange and knowledge sharing. To increase the collaboration with international and regional organizations, support the greening of public health services is something which would be very important in the roadmap, and monitor the progress of the NPHI's involvement in climate change policies through key indicators. And this is really a goal that we have to achieve, is to increase this involvement in NPHIs in climate change policy. May I have the next slide, please? And I'm done. So I went very quickly, and if you have questions, do not hesitate. I would like to thank again all the members of the working groups, and also I would like to thank Louise Rigal, who is with me from the Secretariat, who have supported the work in 2021 with the colleagues who are present today. Thank you.
Thank you, Anne-Catherine. I think that was really quite succinct yet comprehensive, and thank you very much for sharing in detail also the interesting results of the survey. And thanks again. You're on mute, Anne-Catherine, I can't hear you.
Yeah, sorry, I forgot to say that the roadmap will be launched on November 1st. At the COP26 or during the COP26 period. So I think it's a very important milestone for us and for everyone, and for all the NPHIs and for YONFI, for which this will be the first time we have a real position paper as an association. So it's to show the importance of climate change and health for NPHIs to mobilize such an association. So thanks a lot.
Yeah, thank you very much. And having closely associated with you over the last year from the UK HSA and historically Public Health England, fabulous work, and thank you for your support to the National Public Health Institutions as well. I think it works both ways. So thanks again. So reminder, that the position paper will be launched alongside COP sometime between the 1st and the 12th of November. So keep your eye, watch for this space and for the beautiful document that we will bring out, which IANFI will bring out. With that, I have the pleasure of moving to the next speaker today, Dr. Mathilde Pascal. She also represents Santé Publique France. She is Climate Change and Health Project Manager within the Occupational and Environmental Health Department of Santé Publique France. She brings expertise in physics, environmental science, and epidemiology, and has very strong quantitative interests. She's head of the program for climate change and health in France, and also leads on the health impacts assessments. And she is going to talk to us about the all hazards approach to local climate change adaptation planning. Over to you, Mathilde.
Thanks. Thanks a lot. I'm very pleased to join this session. I will try to illustrate with a very concrete example the role of the French Public Health Agency, Santé Publique France, in extreme weather events, with a focus on tropical storms, really a focus on what we have been doing in the French West Indies. So if you can move to next slide, please. So the extreme weather events, it's a good example to consider the role of National Public Health Institute in climate change, and especially with regard to adaptation, because it really mobilizes all the core functions of NPHIs, from risk assessment, emergency response, monitoring and surveillance, evaluation, planning, and prevention. And you will see really the diversity of the tools and of the expertise that is behind each of these functions. The work is also really based on intersectoral collaborations with the local and national health authorities, with the health professional, the hospitals, the general practitioners, but also with the local decision makers, with the Met Office. So it's quite a wide range of actors that are involved in all the steps, preparation, surveillance during the event, and evaluation after the event. And it's also based a lot on community involvement. And the role of Santé Publique France toward extreme weather event is to give a comprehensive evaluation of the impacts, of the risk and the impacts, and support evidence-based prevention. And now, with the context of climate change, we must say support evidence-based adaptation. So if you can move to the next slide, please. So tropical storms in the Caribbean, as you probably know, is a rapidly evolving risk. With the recent IPCC report, which has really increased the level of knowledge on tropical storms, and concludes that there is a risk of having less frequent but probably more intense tropical storms, with the potential for more damages. And something that is quite interesting also in this IPCC report is that the winds, the record-breaking winds that were observed during the Irma and Maria hurricanes are attributable to climate change. So the impacts of Irma and Maria can be linked to climate change, and the response is a response to climate change. These storms also have multiple health impacts, from direct impacts, destructions, victims, traumas, injuries, indirect impacts through the opportunities for the development of infectious diseases and vector-borne diseases, discontinuity of care, mental health, immediate and delayed impact. And all this impact, and especially the indirect impact, are observed both on the very short term, very acute impacts, but also on a longer term impact. And we now have a really comprehensive picture of the diversity of the health impacts of extreme weather events, which is far more than the total, the immediate victims. If you can move to next slide. So to give you a very practical example of what NPHIs can do, the first thing is emergency preparedness and response. So to illustrate that, I took the example of September 2017, where the French West Indies faced 3 hurricanes in a very short period of time, Irma, José, and Maria in less than 2 weeks. And especially Irma resulted in major material damages in Saint-Martin and Saint-Barthélemy, with destruction of key infrastructures, disturbance of access to drinking water system, lack of food, almost complete destruction of the hospital. So the emergency response was observed, it was organized between September and December, based on an evaluation of the risk, an assessment of the need to restructurate and reinforce the healthcare system. And this was based on the sending of more than 600 health professionals with a very wide range of specialties, from nurses to logisticians, medical doctors, tons of materials, foods, drugs, bed camp that were sent, and all the organization of the emergency response was based on the weekly updates and epidemiological analysis that was produced by the regional offices of Santé Publique France. So if you can move to the next slide. This epidemiological analysis was based first on an a priori risk assessment to identify all the health issues that were expected to be impacted by the hurricanes. So direct and indirect impacts, including infectious diseases. Also lots of focus on the discontinuity of care that could result in renal insufficiency, for instance, cardiorespiratory decompensation, and so on. So based on this risk assessment, a surveillance system was organized to follow up the short-term impacts based on feedback from the health professionals, from the emergency departments. And you can see on the figure, I'm sorry, it's quite small, it's the weekly number of emergency department visits in Saint-Martin, and the peak that you can see, it's just the week immediately following the Irma. And during this week, a large increase in the number of visits for direct and discontinuity of care impacts were observed. And this very rapid surveillance is key to adapt on the very short term the response, and to release. So there is really a dialogue between surveillance and monitoring and emergency response. And if you can move to the next slide. And the last key functions of NPHI is prevention. So the prevention focused on the short-term impacts, on the control of the indirect potential impact through infectious diseases and through water consumption and hygiene. So you have some examples of communication devices that were developed for the population. For vector-borne diseases, the destruction of habitat is also organized with the local relevant stakeholders. And for the medium and short-term impacts, this was focused more on mental health, with emergency psychiatric consultations that were organized, and a follow-up of the patients using these consultations. So if you can move to the last slide. So I hope I convince you that NPHI is doing very concrete, practical work on in response to extreme weather events and on adaptation. And their objective is really to evaluate the health risk with an holistic approach. So it's both short and long term, acute response and strategic planning. It covers all the dimensions of health, from environmental health to infectious diseases. And with climate change, we see now that we really face new challenges with an increased risk of complex events. We have this risk of more destructive storms, but we have also emerging exposure and events, and for instance, heat waves that can be combined with storms and with infectious outbreaks. This is really a new dimension of complexity for the emergency response. And also today, the focus is mostly on the immediate response, which is essential. But in the context of climate change, we really need to include that in a stronger way in adaptation strategies. And also keep in mind that underlying all the, improving all the underlying determinants of health is really also adaptation. And especially we have still a lot of work to do on housing, equitable access to healthcare, to drinkable water, for instance. So that was my last slide. And I'm happy to answer any question. Thanks.
Thank you, Mathilde. Absolutely. And also thank you for highlighting the short term, the immediate term, and the longer term challenges that national public health institutions play. And again, highlighting that unique position that national public health institutions play. So thank you very much again for that very insightful input from your side. With that, I would move to our final speaker for today's session before we go into question and answer. And I see a question has been posted in the chat. I encourage all the attendees to please give us the opportunity to explain more, because obviously 10 minutes is not enough for people to share everything that they're doing on climate change and health. So please let your questions come in into the chat. And I'd like to introduce the last speaker for today, Dr. Dale Wesson. He is a principal behavior scientist with us at the UK Health Security Agency. Formerly, many of you might remember it as Public Health England. As of 1st of October, we switched names. Dale's background and interests lie in the application of social and health psychology theory and research. And he is basically specializing in behavior interventions, both for emergency response and communicable diseases. He has worked on several national and international projects on preparedness, which speak to all hazards approaches, and also has an interest in behavior analysis and mental health needs assessments. So over to you, Dale, for your presentation.
Thank you very much, Revati. Yeah, so that was a really good introduction to me and an overview of what I do and what I'm going to talk to you about for the next 10 minutes. Or perhaps just under, are the role that behavioral insights generally, but more specifically the role that kind of community engagement, community involvement, and basically just getting out there and talking to people plays in addressing climate change related behaviours. So I'm going to talk quite broadly, generally about the way in which we do behavioural science and we use behavioural insights to inform interventions, to change and modify behaviors, and I'm going to draw on a specific example as well. So next slide, please. Like I said, the real emphasis in this presentation is going to be on giving you a sense of how we understand barriers and facilitators to behavior, and how we use these barriers and facilitators to develop and implement interventions. And these interventions can be for any kind of behavior, as we'll see on the next slide. But really what we need to do here is we need to think about behavior in a slightly different way. Now, in a behavioral science informed approach to insight gathering and development of interventions, there are 4 key steps. The first step is really to understand and to kind of hone in on what behavior is of particular interest. So here it's who needs to do what and differently. And when we have a lot of these kinds of engagements and these interactions, it tends to be quite general. People talk about there is a problem, and that problem tends to be around a public health threat. But what you really need to do in the first instance is you need to take that public health threat and you need to think about, well, okay, what are the behaviors that contribute to it? Because we can't necessarily change the threat, but what we can do is we can modify behavior to mitigate the impacts of said threat on an individual level. I think if you press next, it'll come up with the next step. There we go. Once we've identified who needs to do what and differently, the next step is to identify, okay, so we know what behavior is of interest. What needs to change? So what barriers are there that we know of to engaging in these behaviors, and what facilitators are there or enablers are there that can make these behaviors easier to engage in? Next, please. Next step is, this is BCTs, that's shorthand for behavior change techniques. So on the two sides of this slide, you've got a couple of books, both of them authored by Susan Mickey, who's a very prominent UK-based psychologist. And she has done a lot of work to aggregate together different behavior change theories, because there's a lot of them, and also to look at, well, okay, what are the key components that fit into different types of behaviors, and what sorts of interventions might there be, or what sorts of intervention categories might there be that we can use? So whether it's better and clearer communications, whether it's providing incentives, whether it's changes to the structure, or what have you. And you kind of see this writ large in a lot of different contexts. And I think the really key thing to take away here is that when people talk about behavioral science, they quite often think communications, telling people what they need to know and informing people about what they should do and why. And that is one really key element, absolutely, but it's not the be all and end all. There are a lot of other elements to behavioral science as well. For example, changing the infrastructure. So one example of kind of a commonly used behavioral intervention is if we want to reduce the amount of junk food that people eat, moving junk food away from the checkouts or tills at the front of supermarkets reduces kind of opportunistic picking up, and replacing it with healthier snacks can kind of reduce opportunistic buying of junk food. And that another example would be taking the packaging away from cigarettes and making it uniform, as they've done in the UK, and putting cigarettes behind kind of closed shutters. Those are some examples of kind of interventions that tackle some of the elements in particular behaviors, that in that instance, smoking cessation, that don't necessarily relate to communications. Next, please. And then how do we measure and understand behavior change is the next kind of key point. And here, it's about evaluating, understanding, and assessing behavior change. Next slide, please. This is just kind of a presentation of what I was just saying. You know, in order to engage in a behavior, you need to have the motivation, which most commonly speaks to people talking to you about information and what to do. You need to have the capability, and you need to have the opportunity. You need to think that you can do a behavior. You need to understand how to do it. You need to have the skills to do it, and you also need to have the opportunity. So it needs to be accessible, easy, and specific. And on the right-hand side, there are a few different kind of mechanisms through which we can kind of develop interventions. Next slide, please. And the key point here is we know that climate change has a wide range of potential public health impacts, and there's a range of them there. Next slide, please. But in particular, the case study I'm going to very briefly run you through focuses on is the increased risk of expansion and contraction of vector-borne diseases. And it's important to really understand both behaviors that can be undertaken to reduce climate change, but also to mitigate the public health impacts. And that's kind of where we come in here. Next slide, please. And so all I'm really doing here is just talking in brief terms about, so we were asked to go out to Anguilla in October 2019 to help the local vector-borne disease teams to understand what the barriers and facilitators are to people engaging in kind of mosquito prevention behaviors in their homes and in their local communities. And so what this involved was going around to a lot of communities and just talking to people, having a really loose kind of structured conversation with people around what they're doing, what the kind of behaviors they're undertaking to reduce the mosquitoes in their area, their perceptions of mosquitoes, their perceptions of the risk of mosquito-based hazards, with the view of identifying kind of potential behaviors that could contribute to mosquito breeding, but also to understand the barriers to uptake of these behaviors using behavioral science paradigms. Next slide, please. I'm not going to go into a lot of detail here, but just as part of the observation and walking around and talking to people, we identified a whole load of behaviors. And so this is just really illustrating the importance of getting out into the community, talking to people, looking at what people are actually doing as well. And we can identify a whole load of behaviors that might contribute to mosquito breeding and kind of the presence of mosquitoes. Next slide, please. And so the next step is also to, through these conversations, identify, so we've got a load of behaviors. We want to identify potential barriers to these different behaviors and then code these barriers according to different components of whether they address capability, opportunity, and motivation. And then to look at any potential interventions or facilitators that map to these barriers themselves. Next slide, please. And again, I'm not going to go into an awful lot of detail here, but this is just one example of the way that we categorized some of these barriers. So we've got a COM-B component on the left, physical capability. We've got a series of barriers to engaging in general mosquito prevention behavior, lack of desire to act, lack of control over others' behaviors, the amount of disused equipment in their gardens, requirements to install mesh, etc., etc. And then in the next column, we've got a series of potential interventions that might be useful. So providing support from vector control to put in mesh in place, particularly for vulnerable groups, collections of tires and other wastes, vector-borne disease control team members to carry control materials, to visits, assistance to remove plants, things like that, and many more. So you see what we're doing here is we're engaging with the community, we're listening to the problems, we're identifying barriers and facilitators, and suggesting potential interventions on the basis thereof. Next slide, please. And the very last thing to say is just kind of the next actions that we had were to use this initial scoping exercise to identify behaviors to target, and then to do surveys, interviews, and more community work to try to understand what interventions would be most appealing, and then to evaluate those interventions. But then COVID happened, so we have not yet managed to go back and continue this work. Next and final slide, please. And so really the key take-home messages here are that these behavioral science approaches and frameworks exist that help us to gather these insights. And it's really only through community engagement, be it through visits, surveys, interviews, qualitative focus groups, that we can generate that information that will help us to develop interventions, such as the ones that I've just presented, in a variety of different contexts in order to address and mitigate climate change. Thank you very much.
Fabulous. Thank you, Dale, for that 101 on the design of effective behavior interventions. Thanks a lot. With that, if I may request all the panelists to turn on their videos, please, and we can take some questions. We won't be able to go through all of them, but we have about 12-13 minutes. I'll give the first one to Anne-Catherine. There's a question for you. How will IANFI collaborate with civil society actors in its action plan for climate change?
Thank you, Revati. So I will try to answer that question, but maybe those who were involved in writing the position paper or the roadmap may add on that. I think what we have to explain is that the roadmap target is mainly the institute themselves and the policy level, because the idea is to make the NPHIs more visible, more engaged, to allow policy level to understand that NPHIs can be really key in providing evidence, in supporting policy implementation in relation to climate change. So this is why we say NPHIs can be key climate actors. With regard to the civil society, it's more like to be effective, it has to be done at the national level and therefore more local as well. And we need to help NPHIs to be equipped to do that job. And some institutes and countries, they have the experience already. And this is something that can be shared. And this is what I think is important is IANFI is there to strengthen national capacities of institutes and also at the national level, what can be done to support different ways to improve population health, to deal with risk, etc. But what we have to do is to have a global message, but at the same time, to be very conscious that many things happen at national level and local level because there are strong capacities in public health. So this is why we are conveying this message through that roadmap and position paper. So, but maybe you would like to add some more.
Yeah, no, thanks, Anne-Catherine. And rightly said, that we are in this beautiful position of brokering the knowledge generating it, processing it, and communicating it to policymakers, or sometimes even being part of that policymaking exercise, and also the assessment in the end. So thank you very much for that. I know that, thanks Matilda for answering majority of the questions which were directly linked to you, but I would give you one question. If you can comment on what you are doing with regard to heat-related morbidity and mortality, and if you would have any thoughts on the civil society question prior from Santé Publique France perspective.
So yeah, from the civil society, as Anne-Catherine says, something that needs to be developed at the local, regional and national level. But the sharing experience with other NPHIs is really important to identify the correct opportunities with the civil society and to make it again concrete and efficient. And in France, we have some collaboration with NGOs in the form of dissemination and sharing of knowledge. As for heatwave, we have now a strong experience of heat prevention in the European part of France, but the regions in the Caribbean and also in the Indian Oceans are not covered by the heatwave prevention plan, which is a concern because we started to investigate the relationship, the impact of temperature on mortality in the overseas territory, and we found a significant impact. And the risk assessment we have is that it could really be heat wave could really become a major problem in the Caribbean and in the Indian Oceans, because the shape of the temperature mortality relationship is similar to what is observed elsewhere in the world. There are some specific vulnerabilities. For instance, in Martinique and Guadeloupe, we have quite a large number of elderly people who are socially isolated and with limited resources. And there is also a lack of preparedness, which is a strong vulnerability. So now we are trying to imagine with the local stakeholders what could be done for a short-term prevention, and also to include it in adaptation plan in the Caribbean, because at the moment it's inexistent in the French plan, in the French territories. But it's tricky because it cannot be similar to what is done in Europe, because the distribution of temperature is too different, and we need to take into account really the local context.
Yeah, thank you very much. And thank you also for sharing the example of the cascading risks, Anne-Catherine, and also your response in the chat. Can I ask you a follow-up question before we move on to perhaps the last question and then some last comments from the panel? Often there has to be a strong public health leader to advocate, initiate, and implement the climate agenda and needed mitigations. Have you seen these change makers in the Caribbean region? And would you be able to kind of provide one or two examples of, either that's the question basically. Silence. So I suspect that the change makers are probably stars at the horizon and probably need to be kind of, have to come forward. I think this is also one of the areas that, Anne-Catherine, do you want to say something?
Maybe change makers are more event.
Yeah, yes, and this is, and this is also one of the COP26 campaign areas, that raising the voice of health professionals in building that critical mass of people and organizations who can demand that, the ambition, overall ambition for climate change mitigation and adaptation is raised. So again, watch this space. Perhaps there are some stars at the horizon who will be coming forward. And then I would go to the question one for Dale, for you. How can behavioral science techniques be used to change the behavior of policymakers with respect to climate action?
The $1 million question. I think so. There are ways, I think, of communicating information that are kind of behavioral science informed. So, you know, making sure that messages are kind of specific, are easy to follow, that they're kind of concrete, I suppose. I guess if I'm trying to influence policymakers, then what I'm going to do is I'm going to do some research. I'm going to lean quite heavily on the research, and I'm going to lean quite heavily on primary research, ideally, that I have done. And so there's no clearer and better way, I think, of providing that influence than being able to say, well, we've done this piece of work. It shows this, and this is what people think about it. And that is kind of certainly in the UK, we're in a position where there's kind of a lot more emphasis on behavioral science and behavioral insights, and kind of a growing recognition of the value that understanding human behavior, and also understanding evaluation in general, and the importance of evaluation of rollouts, and getting kind of feedback from that. I'm in a lot of meetings at the moment where that is kind of okay, well, we need to ask people, and we need to kind of understand public perceptions and public responses. So I think it's really that is kind of my main tool in my arsenal when I'm trying to talk to policymakers, really. In terms of how you can get through to policymakers, yes, kind of clear messaging, as simple as possible, actionable and concrete.
Thank you very much, and thanks, Matilda, for sharing that thought as well. And that also highlights the importance of the regional collaborations, right? That how can we learn from each other? How can national public health institutions also come together for sharing the tools, methods? Because we are at different stages. I think there's a very strong saying going around, right? That we are in the same storm, but not in the same boat. And I think that also applies to where we are with our capacities to understand and respond to climate change impacts. So I would like to give the floor to the panelists. If you have one last thought to share for this overall message of national public health institutions and their role in responding to the climate emergency. Any last thoughts from the panelists?
Well, I think we have a lot to do as NPHIs for sure. And the roadmap is a good way of organizing our actions and to try also to discuss with other stakeholders at global, regional and national level and local level. But first we need to mobilize NPHIs and to engage them in climate change and health activities.
I think all I would reflect is that there's quite often when we're trying to engage in behavior change or get messaging through, there's quite a lot of mistrust in kind of the organizations that are communicating. And the best way for me of mitigating that mistrust is to get out into the communities, is to ask them for their view, is to make changes on the basis of what they say and to feed that back. And it becomes kind of a two-way co-production relationship. And I think that's where community engagement is really key moving forwards.
Thank you, Dale. Matilda?
Yeah, maybe to tackle a slightly different issue, NPHIs are really evidence-based, and they are really based on knowledge and data. And in some territories and in the Caribbean, there is a lack of knowledge today on the health impacts of climate change, on the monitoring of some determinants and so on. So I think this conference is really amazing because it's, I hope it will be the starting point of a lot of research and collaboration, and that will really improve the work that we can also do as NPHI, because we'll have more evidence.
And that's a fabulous conclusion to this panel, because Anne-Catherine says we have lots to do and Matilda says it's a good start. So I think with that, I will give the best wishes and a big thank you to the panelists and to everybody who participated in this session. We can't really see all of you, but thank you again, and have a good rest of the sessions. We will be moving on to the COP26 one immediately hereafter, and hope to see you all sometime somewhere. Thank you. Bye.